PossAbilities is a social enterprise. We're a community interest company and we deliver services for vulnerable adults across the North West and West Yorkshire. We are a spin-out from a local authority, so we took all of the learning disability provider services out of Rochdale Council. And I think what's different is our culture.
So we were recently named the Sunday Times best place to work in the health and social care sector, big companies. I think that to me just shows how happy people are to work here, how safe they feel working here, how valued they feel by the organisation.
One of our company values is about being happy, and it's really important that our staff are happy, because if they're not happy then the people they support are not going to have a good day. So we'd had our currency, the system that we were using for around 10-11 years. Over that period of time we gathered lots of data, but it wasn't telling us anything. The system was quite cumbersome.
Information was everywhere. So we had a little bit in our old digital care management system, a little bit on paper, a lot in people's heads. So rather than them looking at information to make decisions about how they were going to manage the service and take action, they were crunching the data, they were trying to get the numbers in the first place, getting in the way of the care and the support that they're providing, and often not being able to do that as well as we would like them to, because that's not what they came to do in the first place, so it creates a lot of pressure and negativity.
I had a whistle-stop tour of Health Connect and it blew my mind. I am the least techie person in the organisation, I will confess. It's like embarrassing. One of my strengths is innovation and wanting to do things differently, and Health Connect does both.
My main feature I really enjoy is the dashboard, because I can see in real time as diaries are going on where care plans are being created, and then with just one click you can access that and see exactly what's gone on. We're currently uploading care plans and risk assessments. With the use of the AI we're then able to look at the current care plans, see what information's missing, and because it's in CQC and NICE guidelines we can see all the information that we need to be inputting.
Rather than how do you quality check the notes once they've been written, shouldn't you be looking at a system that looks at how your notes are written in the first place? For staff to be able to learn as they go along, and the use of AI for that, I think that quite excites us.
The diaries are then matching the care plans. If we need to make changes, if there's any risks, which it flags up. If so staff are missing something that they've not flagged, it will flag up in a diary.
So Gary works here on the farm, spends a lot of time here, don't you?
Yeah.
And has quite a lot of friends here as well that he spends time with. When we can have some better information in our system, we want to be able to support Gary as well we can with all the things that he wants to do and all the outcomes that Gary wants to achieve. By having Health Connecting as a system, we're going to be able to have far better evidence of the outcomes that people are achieving, and also some better tools, better planning tools for people like Gary to have conversations with us about what they want to achieve, and then for us to be able to evidence that that's happening.
I can access my own Health Connect on a service user platform, which has different sections that I can go into, including personal hygiene, health appointments, what I like to do, what I don't like to do. I think it might help PossAbilities to be more inspirational. It's an easier way for our staff to be a lot more intelligent with using AI and technology.
I want them to understand about people leading gloriously ordinary lives, and I want them to know that people are having amazing days when they're being supported by PossAbilities. So those are the things that I want for staff, and like I said, to be able to take time to care, because that's why they came into the job. We want to be outstanding, and I think that with the introduction of Health Connect, we will continue to be an outstanding care provider.